Greetings to all. The objective of this video is going to show you how to operate this sinister looking soft diabetic cataract, and this video will end into an important learning about how to hydro-implant an IUL, especially for beginner surgeons who are afraid of implanting an IUL under irrigation without using an ounce of visco. My name is Dr. Simanchal Goyal, and let's start with this case by injecting some dye and staining the anterior capsule. Yes, we are going to not use a direct chop in this case because diabetic cataracts, after you gain a lot of experience, you will notice this strange cortical appearance with the peculiar brownish hue to the cataract. And once you open up that capsule, you're going to realize the cataract is not hard. It is sticky. It is the consistency of jelly. Once you use that sharp chopper of yours, it's going to cheese wire and go through and through the nucleus. So using a direct chop is not the right technique in these cataracts. Either you go for a horizontal chop if you're familiar with it, or you can simply use a flip and chop. My favorite is either flip and chop or carousel technique. You're going to use carousel, a mix of carousel and flip and chop in this case, because once you lift that nucleus up, you can go with flip and chop, and those heminuclear pieces can be directly taken away with a partial carousel. It will be a fast case. The video is around 5 minutes long and the case will be gone. The two most important learnings which I want to lay emphasis on is during hydroimplanting an IUL, you need to take care of two things. You should keep a steady hand holding your irrigation port in your left hand so that your irrigation cannula protects the endothelium from an opening haptic. Your opening haptic should not scrape off the endothelium, causing injury to the endothelium. And the second thing, most beginner surgeons are fearful about the IUL rupturing the bag. If you're not using visco, never have I ever seen an opening IUL rupturing the bag or injuring the bag. Mark my words, when I was a beginner surgeon myself, I asked my guru that whether he has ever seen a PCR from an opening IUL under irrigation, to which he said, no. You can absolutely trust me on this that an IUL would never injure a bag. So you can put those IULs safely under irrigation. The IULs are made in such a way that their edges are really smooth, they're soft, they're pliable, and they're malleable. They won't injure a capsule. Capsules are really flexible and elastic. They can accommodate an opening IUL really easily. So take this fear out of your hearts and just try hydroimplanting your IUL the next time you go in the OT. The main benefit, the main advantage of hydroimplanting an IUL is you won't get those high IUP spikes in the post-op period, and it really cuts your surgical time down, erasing 3 or 4 steps out of your surgery. In the conventional surgery, you're going to put visco and then the IUL, then you're going to wash the visco and then you are going to hydrate the wounds. Nah. You directly take the irrigation cannula, put the IUL, and boom, hydrate the ports and you're good to go. The surgical time decreases, the chances of infection decreases, the chances of patient experiencing the pain decreases, and a lot more advantages. This is the most efficient way, and you should learn the most efficient way and nothing else. Yes, when you are beginning your surgical career, it is good to visco implant the IUL. I also sometimes do only in premium cases, in torics and in multifocal cases, not in ordinary monofocal cases. And just like that, I have held my left hand steady with irrigation. I am protecting the endothelium, and putting the leading haptic inside the bag, and the trailing haptic is ready to open. And before it opens up, I'm going to simply nudge the trailing haptic inside the bag with my aspiration cannula. And yes, the case is done. Simply. There is not an ounce of visco that is left in the AC to just block that triple meshwork and create that IOP spike in POD1. Hydrating the left side put. I hydrated the too much. Hydrated the side put too much. Sorry for that. But yes, hydrating the main put, and let's call it a day. Let's call it a case. That's all from my side. Thank you, and hope you have a great day ahead.